Okay, I'm hoping everybody can hear me. If you can't, type in the chat so we can correct something. I'm Dr. Van Dyke. I'm an endocrinologist, board certified, and practicing since 2018, located in Mansfield, Texas, so kind of right in between Dallas and Fort Worth. And I'm doing this session today for patients with diabetes who are wanting to understand more about their disease, because really having some mastery of how that disease works is the key toward success. So I'm going to share my screen, and as we go along, if you think of a question that you would like answered, pop it in the chat and we'll go through all that stuff at the end. So give me 1 second here. All right. So kind of as I hinted here, we're talking about thriving, not just treating diabetes. And with modern advances in therapy, we're very much talking about thriving. This is not grandma's diabetes, okay? With the resources that we have available to us right now, we are not worried about amputations, about dialysis, about blindness, heart attacks, so on, when we are aggressively intervening, especially early in the course of disease. So I'll give a caveat here that this discussion is focused really on type 2 diabetes. So if there are type 1s in the talk, know that a fair amount of this is applicable to you, but we could always do a session that's devoted to type 1 if you want to. All right, so our ability to succeed is neatly tied into how well we understand the process of diabetes. And make no mistake, this is a complicated condition. Um, it's not just about your pancreas, and it is inherently a progressive condition. So for folks who end up requiring insulin in the setting of type 2 diabetes, it's not a failure, it is an evolution, and we have to be ready for that possibility. Most of the long-term consequences that I hinted at, the risk of amputation, the neuropathy, the blindness, heart disease, et cetera, all that stuff begins in the pre-diabetes phase. And so in that sense, pre-diabetes is a misnomer. We really should be calling this phase 1 diabetes. When we invest early and aggressively in treatment, we see huge dividends paying off down the road. And I don't just mean in the same year, I mean over 5 years, 10 years, and so on. It's important to recognize, as we mentioned, this is not just a pancreas problem, that diabetes has its fingers in everything. And so my job is to ensure that we are choosing therapies appropriately that are going to not just control sugar, but confer additional benefits that protect us from all these things that we're worried about down the road. I need you to know that you are absolutely not alone in both the diagnosis of diabetes and the frustration and possibly the burnout in dealing with it. There's almost 500 million people, billion, living with diabetes across the world. In the United States, we're looking at approximately 40 million. However, this is old data. This is pre-pandemic data. When we factor in phase 1 diabetes or pre-diabetes, all of a sudden we're talking about almost half of the United States population is dealing with this condition in one way or another. And we spend 400 billion with a B dollars on this condition every year. It's important to know that depression and anxiety are more common among those who live with diabetes than they are in the general population. However, they are less recognized, undertreated, and this is because most physicians or nurse practitioners or whomever is managing your diabetes, they're so hyper-focused on the sugar that they forget about the other stuff that's part of the quality of life. And diabetes it's not like pneumonia. You get pneumonia, you take an antibiotic for 10 days, and then you're done and you move on with your life. And that's just not the case. This thing is always there. It always requires your attention, and it can progress. So we're going to talk about your new motto going forward. And that is, the more you do for you, the less we do to you. So think about that for a second. The more you do for you, the less we do to you. And that is always money in your pocket. And the point I'm trying to illustrate here is that lifestyle is always going to be the cornerstone of our best outcomes. Okay. And the more optimal lifestyle integration that you have in your day-to-day life, the fewer drugs and complications that you're going to have to deal with. So let's talk about a roadmap to success. As we've hinted at, knowledge about this condition is your power. The better you understand the process of how this disease works and evolves, the better you can control it. It's important to recognize that diabetes management is a skill set. We learn it, we practice it, and then we adapt it as we go because it's a moving target. So, are you ready for your roadmap? Let's do it. I'm going to introduce you to the ominous octet. Diabetes isn't just about sugar. It's not just about insulin. And it's not just about carbs. There are so many organ systems involved. In fact, the octet is kind of an old concept. Now there are more systems involved that we're seeing in the literature. Also recognize that other diagnoses and their treatments can make diabetes worse. And the most glaring culprit here is anything involving steroids. So rheumatology diagnoses, certain cancer diagnoses were prednisone, methylprednisolone, dexamethasone, even joint injections for pain that carry steroids in them. This will make your blood sugar just blow up. And we got to be able to work around that kind of thing. The point of the ominous octet is we want to be able to attack this process from as many of those underlying mechanisms as possible. So now I will introduce you to what I call the magic trifecta of medications. Every one of these classes of medicine are conferring different benefits. And they're going to attack all of this from those underlying processes. More importantly, these medications are pretty easy to take. Most or all, actually all of them are available in pill form. Let me turn my light on. They're smart. They're going to work when the sugar is high. They're going to stop when the sugar is normal. So your risk of a low blood sugar is almost zero. These medications are going to provide maximum ancillary benefits, that protection that we're after for the heart, the kidneys, the nerves, etc. So the heart, the kidneys, blood pressure control, very important, weight management. So let's find out where they work. So metformin, my all-time favorite medicine in the whole world ever, is our cornerstone of the magic trifecta. It's going to work in these 3 places. So we're 3 for 8 so far. The second leg of the trifecta are the GLPs. Everybody knows what these are now. These are your Ozempics, Mounjaros, Victozas from back in the day, Trulicity. So where do they work? Well, they work in a lot of places. Yes. So now we're 7 for 8. And the last leg are the SGLTs. You will have seen these ads for Farxiga or Jardiance. There's also Invokana, Steglatro, a couple of others. So look at this. With these 3 classes of medication, we have attacked the process from every one of the underlying mechanisms while getting maximum benefits out of them. Now we have diabetes tech. So like we said, burnout is real. because this is a thing that never goes away, and checking blood sugar is a burden. Some people on multiple injections of insulin, you got to dose 5 times a day, which means you got to check sugar 4, 5, or 6 times a day. So continuous glucose monitors are the thing that most people are familiar with. And I'll show you some examples here. This is Kate Moss's daughter, who's a supermodel. She's wearing a Libre continuous glucose monitor. And then we have our Jonas brother here wearing a Dexcom G7. So these are sampling your blood sugar automatically every few minutes. They send that information to your phone. They alert you when things are running up or crashing down so that you can take evasive maneuvers. For those who require multiple doses of insulin in a day, we have insulin pumps. This is a T-Slim. It's one of many pumps that are on the market. And every pump on the market now functions like an artificial pancreas. So it's going to get its data from the sensor in question, and it's going to apply an algorithm to that to predict where your sugar is going to be in about 20 minutes. And it's going to turn up and turn down insulin flow accordingly. And there's a bunch of variations on this. Some of these are really very, very impressive algorithms that get as close to set it and forget it as we can imagine. There also are smart insulin pens. So for someone who needs multiple injections, but they don't want to wear something stuck to them, they can use one of these smart pens that syncs to their sensor. It syncs to an app. It does all of the calculations for the doses for you. It gives you reminders when to take all your doses. There's even inhaled insulin. And this is for mealtime only, but it is ultra rapid acting insulin. And so you can take a pull on your little whistle there and begin eating your meal immediately. You do not have to wait for that insulin to activate. There are also insulin patches. I don't have a photo of one of them here, but you can think of them kind of like a low-tech insulin pump. So some parting words here. I don't want to overwhelm you with too much information, and this has been a lot in a short period of time. Somehow we went back. Okay. We've been providing diabetes comprehensive care since 2018. And in our experience, our patients are thriving when they're getting enough time with their doctor. And it's very important to us that we spend about an hour with a brand new diabetes patient when they have access to the resources that they need. And that's a lot of resources. And so we serve as the hub for ensuring that all of the associated risk factors and educational needs and all of those referrals are managed with us. And when they are empowered to understand their disease and how to modify their approach, then it's not just about getting an A1C down to 7 or 6.5 or whatever. It's about being able to go out and live your best life and have that A1C at goal. And we help patients lean on technology to reduce their burden of care. So if you think that this has been useful, you've learned something, I encourage you to work with us and invest in your health and your wellness in the long run. You will get your best results that you've ever seen because of the type of approach that we take. And I can guarantee that no one else in the Metroplex is currently doing it this way. And if you think you know somebody who would benefit from either this session or future session or working with us, of course, let them know. We're here to help. In this photo here, our lady on the left, this is Miss Jackie. She is kind of the boss of everything. She keeps it all running smoothly for people who have questions or problems, need to be scheduled, need to understand reimbursement, all that kind of stuff. And then Nurse Pam is in the middle of that photo. She is our lifestyle coach. She is certified insulin pump trainer, and she is the best damn diabetes nurse that I've ever seen in my career. So we were privileged to be nominated as a top doctor by Fort Worth Magazine, and our peers voted for us for that this year. And also you can find us on social, Instagram, YouTube, and Facebook at Dr. Van Dyke DO. So you can stay tuned for more events like this. We'll do probably this diabetes session once a month for patients. And then we'll be adding other sessions about weight management, about thyroid nodule management, because there's some pretty exciting non-surgical ways to help thyroid nodules these days. So with that, I think I'll turn it over to the chat. If anybody has any questions, let's address them here. And when we've answered everyone's questions, then we will release you back into the wild. Okay, I'm not seeing any questions there. So thank you. Oh, here's one. Do you want to get a copy of the slides? Great question. Let me collect your email address. I can send you that slide deck. And then I'll also be posting this recording on our YouTube channel so that you can re-watch if you have additional questions or you think you missed something. Any other questions? All right. Well, thank you everybody for your time and attention. I hope to see you at a future session and go out and live your best lives.